Thanks to all the witnesses that have come today. Dr. Hildreth, I was very interested in your opening comments. I had a very good conversation with Dr. Montgomery Rice recently of Morehouse College, and she was sharing with me some very similar ideas that you had expressed about expanding education, and she was particularly interested in Southwest Georgia, around Albany, Georgia, and really one of the hardest hit areas in the state of Georgia. So thank you for your work on that. I found that the conversation with her was very enlightening and very encouraging as well. And I think you're on to something there, going into underserved regions, not just communities, but underserved regions. And I think that's an area that Morehouse could be very, very successful in. So in some of your opening comments, thank you for that focus, and look forward to having future discussions with you on those topics. Again, I think it's a golden opportunity there, and I'll leave it at there. But thank you again for that. As we go through this, I was a dentist in a rural community for 25 years, and when I went to work every single day, I saw patients of every socioeconomic background, and came from all different types of communities. And clearly, going back to then, we saw real challenges with different groups, and not just accessing healthcare, but really in a lot of the things, the practices that they had every single day, and particularly around preventive medicine. All too often, what we found were people that lived in poverty operated more in the crisis of the moment, as opposed to thinking about the long term. And it's it's the nature of where they were. And so as we look at a lot of the data and a lot of the numbers, and one of the things that I'm very curious about is, have we looked at and this is for any of the panelists that may be able to answer this question, but looking at the data, and if you're in a rural community, if we looked at, obviously we see the data on impacts, particularly in Georgia, on African Americans, but if we looked at it from an income stratification as opposed to just simply a racial stratification, do you see similar comorbidities, fatalities, and problems with poor whites, poor Latinos, poor African Americans? If each of those and each of those different races are in a higher income strata, does a financially successful African American family have a lower risk of infection than does one living in poverty? I'll ask that question because, again, I'm real focused on the poverty side of this right now, and looking at the economics of that. And Dr. Hilbert, I'll start with you on that if you don't mind.
Sure. It's very clear that your economic or financial status does have an influence. For example, poor people are more likely to live in close quarters where there's an opportunity for the virus to spread more quickly between them. Those individuals who have higher incomes tend to live in situations where they can be socially distant. They can work from home, for example. Most minorities cannot work from home based on the nature of the work that they do. And let's be clear, whether you're white, Black, Hispanic, Asian, if you have some underlying conditions and you get infected, you have a risk of severe disease and death. But as we said before, certain individuals in higher economic status are going to be less likely to become infected in the first place. It's not about susceptibility to the virus. It's susceptibility to what happens when you get infected by the virus. And on top of that, poor people have a greater chance of getting infected because of the types of jobs they do, where they live, using public transportation, the list goes on and on. So financial status does matter, but those other things matter a lot more as well.
Okay. So as we look at this, and let's talk about that the economics, particularly in rural America, and you talked about the types of jobs that different people do. It's one of the real challenges that we have in rural America, and we see this in rural Georgia, is lack of access to broadband. I mean, this is, and then having an education system that aligns with that. I believe very much in the talent of all of the people that are in rural America. They're incredibly creative, incredibly hardworking, but we've got to get them connected to to a different type of economy. And so I hope that one of the things that comes out of this discussion is a real recognition that access to broadband in our rural communities is very important. Dr. Holtze, can you talk to how the economic disparity that happens in rural America because of the lack of broadband access, and also the health component, the healthcare component of that?
Yeah, I'll be brief because you deserve a better answer. I will send you more in writing. But I do want to emphasize one thing, which is that previously a lot of people didn't get broadband, and it wasn't because of the price. It was they didn't see any point. And one of the things I'm very curious to see is whether there will be a new recognition of the importance of access to broadband. And on the others, I will get back to you.
Okay, thank you, Chairman.